Hi everybody, Dr. Daniel Shanahan here again from Lakes Foot and Ankle Associates. Thanks again for checking out our latest YouTube video. And as always, make sure you receive our latest content. Subscribe by clicking that button below. Hit that bell icon to receive notifications. And if you ever have a question you want answered, leave us a comment. We will definitely get back to you. We love to teach our patients and answer their questions. This is the 5th video in a series of videos addressing foot pain. Our first video was on the topic of general foot achiness and fatigue. The second video addressed pain to the ball of foot area. The third discussed nerve pain issues, and the fourth was related to midfoot and rear foot pain. And you can find links to all these in the description below, or of course on our YouTube channel. This last video will address the topic of joint pain throughout the entire foot. If you ever look at a skeleton of the foot, you will realize there are a lot of joints that make up the foot and the ankle. And if you think about their various shapes and the way they have to move, it's no surprise we get achy joints in our feet. Some of them act like a cup and a ball, like our big toe joint, interacting with each other. Some are flat, some are curved, and some you really can't even describe their true shape because they're so kind of odd with their anatomy. But all of them have to work in harmony with each other so you can walk and run pain-free. Of course, the term arthritis is very loosely thrown around all the time as a reference to joint pain. However, the term arthritis, it literally just means swollen joint. Well, that doesn't tell us enough about the problem with the joint and the reason for it developing pain. And there are a lot of different types of arthritis. The most common, of course, is osteoarthritis, otherwise known as degenerative joint disease. That's when our bones start to wear down and become bone on bone because our cartilage goes away. There's also rheumatoid arthritis, psoriatic arthritis, just to name a few. And these are related to systemic disease issues that can cause destruction of our joints. So what causes osteoarthritis or degenerative joint disease in the foot and ankle? Well, of course, genetics can play a big role in the quality of your bone and cartilage and how durable they are to the rigors of walking and running. However, one of the biggest reasons is our biomechanics. That's the way that the shape of our foot and all the joints interact with each other to work. In my 30+ years of treating feet, I've rarely seen a foot that has perfect biomechanics. We all have potential issues with the way our feet are built and the way they work that can cause premature breakdown of our joints. And of course, our biomechanics are also influenced by the way that our legs and our hips work as well. It gets pretty complicated. When we take those biomechanics and do all the things we do with work and play, very often in shoe gear that is very poor, and we wonder why our joints start to have problems. So, what joints seem most affected by arthritis in the foot and ankle? Well, any joint could ultimately develop arthritis depending on how we use our feet. But I would say the absolute most common is a good old big toe joint. Just like knees and hips can go bad, so can the big toe joint. People often come in with a big bump of bone on top of the big toe joint and they think they have a bunion. That's completely incorrect. What they have is development of extra bone due to the poor mechanics and jamming of the joint that lead to these arthritic changes. Other common joints of the foot are in the arch area, up on top. This is a very complicated area of anatomy and mechanics and can definitely develop painful issues as we add on those miles. And then the ankle joint itself, of course, can have its own problems. It handles the transfer of weight from our leg down into the foot as it makes a 90-degree turn. So it makes sense why this joint can develop arthritic changes as well. The good news is there's a lot we can do to help prevent arthritis and, of course, treat your arthritis. This can range from simple options like topical meds, custom orthotics, proper shoe education, right up to injection therapy, laser therapy, and sometimes surgery and joint replacements. Dr. Petronella and I are here to keep you moving with happy, pain-free feet. Call us today, schedule that appointment, and let us get started on solving your painful issues very quickly and very efficiently. Thanks again for watching. Please remember to subscribe below. Hit that bell icon. If you have a question, leave it down below and we will address it and get back to you and look forward to reaching out to you. See you next time. Hope you enjoyed the video. There will be plenty more coming. Have a great day.